It is. Well, welcome everybody. It is the top of the hour, so we'll go ahead and get started. Welcome to today's SimSeries webinar, Considerations for Evaluation in Simulation-Based Learning as we all work on responding to the COVID-19 pandemic. Today, I'd like to welcome Kim Layton. Dr. Kim Layton has been with us with the Society for Simulation, has been one of our staunchest supporters for years. She's Executive Director of ITQAN. I'm going to say, how do you say that, Kim? You spell it out each time? Yeah.
Nope, ITCON.
ITCON. Great, thank you. Clinical Sim and Innovation Center at Hamad Medical Corporation in Doha, Qatar. The Sim Center serves a multidisciplinary practitioner community and aims to expand services to the region and beyond. Kim has spent the past 16 years facilitating learning with mannequin-based sim in undergraduate and graduate nursing, medicine, and allied health programs, as well as for practicing clinicians in the public and private sectors. While president of the International Nursing Association for Clinical Sim and Learning, or INACSL, she led development of the Standards of Best Practice Simulation, which has now been endorsed by 20 interprofessional organizations and is now in its third iteration. Dr. Layton's research focuses on development and psychometric analysis of evaluation tools for simulation education, which have been disseminated through her website to simulation educators in 56 countries. She is co-editor of the award-winning book, Simulation Champions, Fostering Courage, Caring, and Connection, and she is assistant editor for the journal Clinical Simulation in Nursing. Kim, welcome so much. Thank you so much and welcome. We're very thankful you're here, and we'll turn it over to you.
Thanks, Kathy, and also to SSH for inviting me to share my thoughts tonight. Well, it's nighttime for me. I know it's daytime for you. It's my bedtime, actually. It's dark here. But thank you for inviting me to talk tonight about evaluation. I think it's so important that we quickly understand the outcomes of our new way of teaching. So I have no disclosures to report. The learning objectives for this presentation are really to learn more about the challenges that are inherent with quickly moving our simulation activities online, and then to consider evaluation strategies in a computer-based environment, because it's a little bit different than what we are used to. So first of all, ITCON, since you're probably wondering what in the world does that mean? It means excellence, so striving for excellence. That's what ITCON means in this Arabic culture. So this is our Sim Center in Doha, and we have 140,000 square feet, and it's in a building that was specifically designed just for the purpose of simulation. Hamad Medical Corporation, it's a government healthcare entity, so it provides care for the entire country, along with some other private hospitals, and then the other main hospital is Sidra, which you've probably heard of. So we support simulation training for clinicians throughout our entire system, which is more than a dozen hospitals, 50-some clinics, and home health services. So the Sim Center has not officially opened yet. I'm so sad, but we were planning for that. And then actually we did our photo shoot, we did our interviews, we did everything. And then about 3 days later, the pandemic officially started. So when you have an official opening here, it's not like what we're used to in the US, where we invite everybody and we have like an open house. Here, the official opening is for the Minister of Public Health and sometimes the Prime Minister. And the Minister of Public Health is really busy right now. So this is the last thing on her mind. My boss is also one of the leaders of the pandemic response, so he doesn't have time for an official opening either. So eventually, someday, we will open. In the meantime, we do provide space for thousands of learners over the past year. As for the pandemic, because everybody's usually wondering, we are at peak. We've been at peak for, I think, about 10 days. I weirdly thought that, when you hit peak, that meant that the numbers started to go down after that. But it kind of means that they plateau and stay even, at least for us. So we have had over 17,000 COVID cases and 15,000 are still actively being treated, but we've only had 12 deaths. So our death rate is really low. We have an additional 300 ICU beds and 18,000 quarantine beds that are prepared in field hospitals throughout the country, fully stocked and ready to go. So we think that, we have high testing rates, and we've been doing contact tracing for a little while, and early social distancing. I mean, we've been closed down for 10 weeks now, and this is week 8 of working from home. So like all of you, I hope it gets better soon. So again, like many of you, we've redeployed a lot of our equipment and supplies to our hospitals, and just keeping only what was urgently needed for COVID-19 training. So, one day I got a call from an ultrasound machine. This seems like so long ago. Back at the beginning, I got a call for one ultrasound machine. Then a couple days later, 2 labor and delivery beds. Then our computer department wanted all of my computers, which was like 50 some computers and monitors. And then they wanted another ultrasound machine, and oh, can you make it 2? And so that became my job, was trying to track my equipment. Now we have a system-wide warehouse. And so one day last week, a big truck pulled up to my loading dock and took the oddest of things that you wouldn't even think about, like linen hampers. I could understand the crash carts, but I never thought about linen hampers, but that was a big hit. So I have very little left. So we're going to have to get it all back before we have our grand opening. So initially we were shut down completely, but we have been allowed to reopen now for small COVID trainings, situations where we can maintain social distancing and or appropriately use PPE. We do not have the PPE shortage here that you're experiencing in the US and in some other places, but we still are very cognizant of the fact that it can't not be wasted. So, and this picture on the top right, I think you'll find this interesting, but the ground floor of my sim center is now a call center. So it's Ramadan here. We're in the 2nd week of Ramadan. And during Ramadan in the evenings, families, it's a very family oriented time. Everybody gets together at mom and dad's house, grandma and grandpa's house, and the whole family is together every night. So in this older person's call center, nurses are calling elderly Qataris to encourage them not to have their families together during Ramadan, and trying to explain to them why. So they're calling 17,000 people. But it's also an opportunity for them to ask the diabetics what their blood sugars are, if they have any sores on their feet, ask the people with heart failure what their weight is, and if they're having trouble breathing, that kind of thing. So, the main goal is to keep people out of the hospital. And then there's some doctors there in the next room with telehealth equipment so that they can immediately follow up with people if they need to. So, and the bottom right is Hal. Poor Hal. Hal is now living at one of the COVID facilities, Hazem Mubarak General Hospital, where the nurses, the med-surg and outpatient nurses are being trained how to take care of ventilators. So against all of my policies, we packed up Hal, we did a down and dirty training for the educator, and we've supported him by WhatsApp whenever he's needed help. So getting to today's topic, how do we evaluate in current conditions? I mean, this conversation today is going to be about evaluating changes that we've made since COVID-19 became a problem. So there's a lot of schools that had already adapted various online and virtual products before COVID-19. And these were typically, you have to assume they were planned events, they were preceded with some training and some thought behind them. So today's conversation is really about evaluating what we've been really forced to do once schools and hospital sim centers faced closure or had to adapt to new rules. So, this is a good example of the changes. Dr. Garesh is intubating using the glidoscope on the left-hand side 6 weeks ago, and now on the right-hand side, look at all of the PPE that's required to manage airways. This is a picture managing trach care with AvTrach and one of our nurse educators. Now, when you do things like that, they have to be 6 feet apart, or they have to have adequate PPE, which again, we're trying not to waste. Since so much of it has gone online, I mean, it's just simulation as we know it has drastically changed. So that results in some challenges for us. So first, there was, and maybe there still is, a pretty steep learning curve for our learners, our students, and probably for the faculty and facilitators as well. I'm sure anybody who has a sim tech is really grateful to them during this COVID time for all of the technology they've been able to help you learn and use. So Zoom and other online simulation requires cameras. So one thing to think about is, did all of your students have a laptop at home? If they're working from a PC, they're going to need a webcam. Faculty typically have PCs in their offices and not laptops, so they need cameras. I went on a search. So it started with Amazon, and then I went to Best Buy, and then I went to some stores here. I went directly to the Logitech website. I mean, I was just looking for the least expensive camera, but the only thing that was available is the most expensive. And when you think about it, every child who is home from school right now needed a web camera. So it makes sense that they're sold out. But we have to think about that when we're expecting people to learn at home via the internet and to communicate back to us and to show us and to demonstrate things. Do they have the ability to do that? For my staff, and when they're in the office, they each have one office day a week because I have 5 staff and there's 5 days of the week. But they don't have web cameras. So when we have different meetings and things, they have to use the data on their phone. And that's not a good situation either. So recording scenarios in the sim lab, that's been discussed a lot in previous webinars. There's also been discussion about having the learners record themselves, doing like their skills, but nobody's got a photography studio at home. So when you're trying to record skills without moving a phone or an iPad, it's probably impossible to do that yourself. And I know, because I've done this myself, you just say, oh, just have a friend record you. Just have a friend do it. Well, we can't do that anymore because their friends aren't allowed in their house. A lot of our students, a lot of our learners live by themselves. They don't have access to another person to help them. There's also been robust conversation on other webinars and social media sites about supplies. So, some schools have sent them to the student's home. Others have direct ordered for delivery from their vendors straight to students' homes. Others have policies that forbid supplies at home, especially if they involve sharps, which I think is interesting. I mean, I understand liability, but as nurses and healthcare providers, we teach thousands of diabetics to dispose of their sharps at home. And so we have to think about, why aren't we trusting our own learners to be able to manage that? Now, the other thing we have to think about when they're at home is the distractions and the interruptions. I mean, you've probably all seen at least one really funny video online of somebody who forgot they were on camera, walking around without pants on, or using the restroom. There's just a lot of funny stuff out there, but they're distracted. So we have to keep in mind that as they're learning, as they're trying to make sure you understand that they're smart and that they are meeting your expectations, they also might have two little kids in the background that are wanting their attention. So we have to just be cognizant of that. And hopefully you haven't been Zoom bombed in any of your meetings. So despite the challenges, and there are quite a few, you all have moved forward really fast. And there's been a lot of successful stories about how screen-based simulation has been accomplished. But we need to be sure to quantify the outcomes that we're seeing. So, for those of you in nursing, you'll remember that it took a longitudinal multi-site study and a lot of research before we could even get some of the state boards of nursing to think that we could replace traditional clinical with simulation. And to my knowledge, that has still not been approved for advanced practice nursing or medicine or any of the other healthcare professionals. So when the dust settles, the regulatory bodies are going to want to know what you did and how you did it and whether it worked or not. So the National Council of State Boards of Nursing is going to want to know, the individual state boards of nursing, ACGME, they're all going to want to know. And you know what? They should be asking these questions. They should already be asking these questions just based on regular simulation alone, but many don't. But that's a soapbox topic for me, so I'm not going to dwell on that. But they're going to want to know. Are they going to expect perfection? No. Nobody's going to expect perfection, and neither should you. But they will expect you to have evaluation data to support what you did and how you probably going to change some things. So what we need to know is, how well did we do? Can we keep on doing all of what we're doing? Some of it? Did the benefit outweigh the resource needs that we have? Was it an epic failure? I'm sure some of you have had days where you're like, well, that didn't work very good. I'm not going to do that again. But you also probably had other days where you're like, wow, I didn't really think that would work. And it was spectacular. And we should do this all the time. So we have to really quantify what we're doing. So while we're evaluating our efforts, what is it that we need to know? So how is it the same as what we're already doing? How is it different? So you need to think about how were you evaluating before? Can you still use those same evaluation tools, the same methods? And in many cases you can, and I'll talk a little bit more about that in a minute. So for the learners themselves, some of the most common things that we evaluate are knowledge, skills, and attitudes, right? So when we look at knowledge, we basically want to know, did they learn anything? Did the participant, the student, did they learn anything? And what was it that they learned? And how much did they learn? So we usually measure that by a test of some kind, right? So sometimes even pre and post tests, if we want to know how much change occurred as a result of our teaching. Sometimes we evaluate that knowledge in debriefing, and I don't see why we can't still do the tests and debriefing to evaluate knowledge. There's no reason not to. But what we need to think about is how we do it. So if you're still doing paper tests, and not paper tests, paper evaluations, you need to put them online. You need to do that anyway. You put them into your LMS or survey software and collect that data and let the spreadsheets do that for you. It's just way too labor intensive to hand enter data. And I collected data for several years, and when I left that job, there was a pile on my desk, and I'm not joking. The pile was over two feet tall of evaluations that I never had time to enter. And so, my mantra now is, if you're not going to do anything with the data, don't collect it, because it's of no value to you if you're not using it. So if you're still using paper, get it online. And then you have to think about the purpose of your test of knowledge. Is it for formative evaluation or summative evaluation? Is there a grade attached? Because you then need to think about test security. So There are ways of test security, and they cost money. So unless your school already has an online program and they use proctoring software, you kind of have to assume that any knowledge test you give somebody at home is open book. And you have to decide if that's okay or not. And if it is, let it go. There's just some things that we're just going to have to let go right now and lose some of our control. And there's other ways of evaluating knowledge that result in grades. So does it necessarily have to be in your simulation experience? The classroom faculty are likely having the same discussions, so you might want to check in with them and see what their thoughts are on that. Then we look at non-technical skills. So by this, I mean communication, leadership, decision-making, teamwork, and situational awareness. So communication is often evaluated with an observational checklist, and that could still be used for online assessment. That's not a problem. But some things on that checklist might be really difficult to see, maybe even impossible. So look around at the pictures of those that are attending the webinar with you today and think about, can you maintain eye contact with them? It's really hard. When we first started, I did make eye contact with somebody who waved at me, and I started to wave back. That person knows who they are. But it is really hard to maintain eye contact. And it's hard to see nonverbal communications too. It's hard to see what my eyes look like behind my glasses and the screen behind me. And so imagine if you're being graded on your ability to maintain eye contact with a standardized patient who's in another box on your screen. Your only option really is to just sit there and stare at them while you're talking to them. And that's not what we really want to teach people anyway. So, but you can adapt your checklist to evaluate the parts of communication that you can hear. So if you can't see as well what's going on in the simulation environment, then think about what you can hear. So you can hear changes in voice inflection. Does the learner keep interrupting their standardized patient? Are they providing explanations that are unclear? So you can still use your checklist. You just have to make sure it fits what you're able to do in the environment that you're teaching in. Decision-making is most likely observed while we watch people respond and intervene when they're caring for a simulated patient. So we tend to do that from the corner of the room or from the control room. So this can still be done with mannequins and standardized patients. And I know a lot of you have recorded your scenarios and you're using more of a stop and discuss or a reflective pause to better understand the decision-making of the students. It may be easier to evaluate decision-making through discussion or debriefing rather than through observing. And you know what, that's one of those things that you may find, we should probably be doing that in our, what I now call traditional simulation experiences as well. So we have to think about just different ways of evaluating the same concept. Now, when we look at leadership, teamwork, and situational awareness, I automatically think of IPE. And so I'm imagining different professions that are represented together. They're all in the same room. They're caring for one patient or they're caring for a specific situation. Now, I've been to almost every webinar, and I've read almost every post on every simulation Facebook page and social media site. And the one thing I have not seen, I can't remember seeing anything really much about IPE. Somebody smarter than me is going to have to figure out how to make that happen online. But in the meantime, if you're trying to do that, think about the evaluation tools that you normally use. And again, maybe it's just looking at some of those items a little bit differently. And think about other types of simulation too. You know, there's a lot of tabletop exercises, and I actually think that would be kind of fun to try to set that up in Zoom. You know, just like my cousins, you know, every other Friday night, they have a big trivia game with 18 people on Zoom. Well, if they can figure that out, we can probably figure out how to do tabletop exercises and some more interesting things like that. Now let's talk about.
Since beginning of simulation use, there's been a great deal of interest in how learners
Hold on
respond
just
to
a
this.
second. I took that slide from an old presentation, and I guess I did a voiceover on it. So let me tell you what I was going to say. So that slide had a lot of different statements like students like simulation, it's the best thing we've ever done, it's the most fun we've ever had, things like that. So when we think about perceptions, they're important. And I think we need to listen to them. So we've done a lot of work with confidence and self-esteem and self-efficacy in the traditional sim lab. I think it's probably worth doing a little bit of that in the online environment. My assumption is, right or wrong, my assumption is that we're not going to have as much impact on confidence in an online simulation as we will in a face-to-face simulation, but I might be wrong. It would be a pretty easy study to do with a Likert scale. Satisfaction, I'm not usually a fan of collecting satisfaction data because I think our evaluations need to be higher level and driven by effectiveness rather than if the learners liked what we did or if they liked us. But I think for now, it probably is a good idea to get some satisfaction data because it's going to help round out that big picture. So, you know, think about it. If we put 40 hours of effort into creating a scenario and our knowledge scores increase, but the students absolutely hate it, then we have to think more about the effort and whether it's worth it or not. Or is there just something we need to change to make it better for the learners? So we can use satisfaction data to learn more about that, but also to drive requests for more resources. So if hopefully you're tracking some of your time, and we'll talk about that in a few minutes, but you know, if this is labor intensive, I know that all of you that have been putting simulation online have just put probably twice your normal workload into that effort. And so if it's going to be sustainable, then you're going to need more resources. So I think that's the value of the satisfaction data, is that it can drive funding. I've used it for that myself when we first got the mannequin-based simulator, so I know it works. So let's talk about skills. So I think this is the most challenging, but is bringing out some real creativity in a lot of people. So for any of you that don't know, there's a really active Facebook group. It's called Simulation Online 2020. If you're not in that, you need to be. There's just such great information that's coming in and out of there every day. And so they've been doing a lot of discussions about how to move skills and other simulation online. And there's also a lot in SimConnect and LinkedIn about this too. So when we evaluate skills, and I'm speaking as a nurse here, we usually have a checklist and it has way too many steps on it. And the learner's supposed to memorize those steps and they're supposed to do everything perfectly in order. And then they might get up to 3 chances. And if they're unsuccessful, then they're going to fail the skill. And if they fail more than a couple of skills, then they're going to fail the full course. So here's what I've learned about how skills are being done online. And I mentioned some of these before, but some schools are sending supplies to the house. Some are having them direct delivered. Some don't do either. Some allow sharps at home. Some don't allow sharps at home. Teachers have gotten really creative. I don't remember who posted it, but teaching them how to suction with toilet paper rolls and straws. And of course, for those who can have sharps, teaching injections in hot dogs and other kinds of meat and fruit. So if you have a supply of toilet paper, this is possible. If you live in an area, I just got an email from a friend tonight. They still don't have toilet paper at their store. Okay, so if this is the situation that's going on for skills, then we must reconsider the consequences of learners not being able to perfectly demonstrate these skills. If we can't supply the right equipment, if we can't arrange for consistent video recording, then it's just not fair to put a grade on these efforts. So, you know, if your program's been able to send what they need, you might be able to use your checklist to evaluate them, but only if they live with somebody else who can help them with the recording. So really what I think is that we need to be trying to figure out how to rearrange next semester so that we can teach these skills the right way. It's fine for them to practice at home. They should be doing whatever you can come up with for them to get better at this at home. But my opinion is that it's not fair for us to evaluate them in any kind of grade or high stakes method if we have them in this situation. There, that's my new soapbox. So now that we've evaluated the learner, we need to evaluate us. Okay, we're a huge variable in all of this. So how well did we do creating and managing this online environment? I'm going to guess that many of you, if not most of you, were never trained to teach online. It's just not a normal part of most of our jobs, and it's not easy to do it right. You know, it's just like when we all first started in simulation and nobody understood the difference between teaching in the classroom and teaching in skills and teaching with mannequins and standardized patients. We've had to do a lot of work to convince people that it's a different skill set. And teaching online is yet another skill set. And so because of how quickly this all had to happen, I'm going to assume that most of you didn't receive good training in how to make this work. So when we look at our efforts, we need to look at the scenario itself. We need to look at our facilitation. We need to look at how we debrief. This should be happening in traditional simulation anyway. But after every scenario or case, and at the end of every course or semester, we really need a good evaluation. So for the scenario, there's quite a few different tools out there. I'm obviously most familiar with the Simulation Effectiveness Tool Modified. I really encourage you to still have your students complete whatever your regular evaluation instrument is after every single online experience. What that will do is give you some trended information so that you can see if you're getting better. It's not about the student getting better when they do the set M. It's about informing you as to how well you are meeting their learning needs. So collect as much of that data as you can. I was asked early on by Dr. Tanya Schneiderreith to take a look at some of the verbiage on the set M, because one of the questions in particular did not fit into an online environment. So the one item that just didn't work was debriefing allowed me to verbalize my feelings before focusing on the scenario. At that point in time, a lot of facilitators were going to reflective papers and written debriefing as opposed to bringing all the students together. And so I got together with my research team that did the psychometric analysis with me on this, and we changed the word verbalize to communicate. We felt that that would resolve that question and also convey the meaning that it's still a two-way process. You're just doing it a little differently right now. Now, evaluating facilitation, the facilitator is not as commonly done as it should be, but there are some instruments that exist for that purpose. There's the DASH tool that I'm sure you've all heard of the DASH tool that evaluates our abilities with debriefing. This would be a great opportunity to look at that in an online environment. Another one is the facilitator competency rubric. And you can use these tools for self-evaluation to see, oh, am I meeting the same standard that I did in my usual simulation environment? Or your other option is to invite somebody in that can observe you. You know, have your mentor join your simulation case for that day. Have a trusted friend who will give you honest feedback. Have them join you and give you feedback. Have one of the online faculty at your school or a school you're affiliated with, have them join you and give you feedback. They know the best practices for online education, so they can help you with that. Then you need to look at your curriculum overall. So you have to really think hard about whether your program can sustain what you're doing. Your evaluation data and some metrics, which I'll talk about in a minute, are going to help you to make those decisions. But if you're going to sustain this, then you really have to have training in how to facilitate learning online. I think that's a given. So obviously that's resource intensive from a financial standpoint, unless you already have an online program, in which case you'll have internal help. But you also need financial resources for, to make sure all the students have webcams and to make sure that everybody knows how to use them, that type of thing. You have to have decisions about whether supplies can be sent to the house. So there's a lot of infrastructure that goes behind this notion of evaluating the curriculum. And then think about one of the first things that we teach people when they're learning how to facilitate simulation is to choose the right type of simulation to meet the learning objectives. So what you also have to sit back and think when, this fall, maybe this summer, whenever you have time to breathe, you have to think, is doing this online the best way? And you might be surprised to find that in some cases your answer will be yes. You'd be like, wow, that didn't take near as many resources as it does when we do it in person. Or yeah, we really could evaluate the learner when they did that. So why are we bringing them in for 2 hours on a Monday to show us that they can do this? So I think it's going to be a really interesting exercise to sit down and see what you can keep. So I've mentioned a couple times metrics. So time. You got to keep track of your time here. At some point, it's going to become important. It may seem right now like I don't have time to keep track of time, but it's one of those things you need to make sure that you do. Think about how long it takes to create training materials to be done online. So, creating preparation materials for your students, putting surveys online, video recording scenarios. There's just all of those different things that you've had to do that have taken a lot of time, and you need to quantify that. You have to think of the time it takes you to source and get your supplies and your equipment. I mean, we have all spent hours online trying to find, ready-made scenarios, ideas from other people, and having to figure out how to do a lot of it on our own. It takes time. Then you have the setup and tear down for any of the mannequin-based sims that you're still doing in person or that you're recording for the learners at home. And then I'm guessing most of you can probably say you had to help at least one person figure out their technology, whether it was student or instructor, and maybe you were that person that needed to figure it out. That takes time too. Our organization switched to Teams, and I spent 16 hours one weekend just learning the ins and outs of Teams so that I could then teach my staff how to use Teams. Was it worth it? Absolutely. I'm a new huge fan of Teams, but it's labor intensive up front. Then you have to convert your scenarios to an online format. Yeah, I think you may have found that some things don't flow as well as they did. Some triggers to move from one state to another might not be as obvious in an online environment. And then you have to clean. You have to clean everything anytime you walk in and out of the room. I was laughing the other night because I got takeout, and I think I counted up, I washed my hands like 8 times before I got to actually eat my now cold food. So all of those things take time. Your leadership needs to know how much time this takes, because they have decisions to make about what's sustainable and what's not. So make sure you add that up. Okay, so for any of the researchers in the group, you're just licking your chops because there is so much. There is so much research. I would love to be a grad student right now looking for a dissertation topic, because you wouldn't have to look too hard. So just some ideas that I had earlier were, does the skill of the facilitator matter? I just spent quite a bit of time saying that everybody needed training in order to do simulation online, but do they? I don't know, that's my assumption, but it would be interesting to know if outcomes are different depending on how much experience people have teaching online. Does it work from a learner perspective? Some of the things we haven't talked about are motivation. I don't know about you, but so I've been working from home for 8 weeks now, and we've been on lockdown for 10 weeks. There are some days where I just don't do anything. I mean, I just can't. And then there are some days where I bounce out of bed and I just do the work of 3 days. So it all evens out in the end, but it's really hard to get motivated some days. Then you have the cognitive load and the stress of what's going on in the world around us. And you think about the impact that has on our learners, whether they're practicing clinicians or whether they're students. Their future is uncertain. Their present is uncertain. They may be frontline workers where they're facing constant exposure. And so their cognitive load when they're trying to learn in a simulation is going to look different than anything that we've seen before. And I think we have some opportunities to measure that, not just from a, mark on the scale where your cognitive load is, but it's probably time to get out the cortisol tests and things like that have been done in the past. Emotional overload. The distractions are beyond anything that we've ever had to deal with. And I think that we have to really take that into mind when we're evaluating and see what the impact is from a learner's perspective. Then, the computer and technical skills, it doesn't look different if we're having simulation or skills with one person versus a group of people on Zoom. What about performance anxiety? We kind of have a feeling what it's like in the traditional sim lab, but what's it like when you're at home? I can tell you right now, I do not like sitting here looking at myself in the camera and not seeing any of you. It drives me crazy. I do best when I'm in a room of people that I can talk to and see you all right in front of me. So cameras and performance anxiety are something that we have to think about with our students as well. Confidentiality, we all have confidentiality policies, but we have to think about, is that different? How does that look different now? And then, do our online scenarios even work? Because I'm thinking odds are really high that none of you or most of you didn't do a dry run of your scenarios before you started to figure out how to do them online, because there wasn't time. Everybody did the absolute best that they were able to do with the resources and the restrictions and the time constraints that they had. But when the dust settles again, you have to really look at that and see, how did they match up with good scenario design? And if you did something with really bad design and you still had good outcomes, that's worth thinking about too. Is why did that work, even though it didn't follow what we know to be best practice standards? Because the standards are fluid. We have to look at effectiveness of pre-briefing and debriefing again. We've got some really good outcomes in the traditional sim lab, but we don't have them for virtual. I shouldn't say, I think there is some out there on debriefing. So how important is spatial awareness? You know, I think that's interesting, especially if you're learning how to manage a patient. You know, we're asking students to manage patients without having a patient. We went from real people to plastic people, and now we're using video recordings. So how do they learn that spatial awareness that comes with the patient care? And how often? What's the right dose of simulation when you're doing it in a virtual environment? We can't do it just once and be done with it. It's no different than how we think about the traditional simulation environment. I'm just going to start saying that now. It's the traditional simulation. Okay, so in a nutshell, I think you all have to ask yourselves and your faculty and your sim team a good philosophical question. And that is, to what level can you evaluate your students based on what's been discussed here in this webinar? What are your expectations of them? And are they realistic given their current situation? Along the same lines, and I talk about this a lot when I'm training simulation facilitators, and that they always ask, well, how do I grade? And I'm like, well, you don't. They look at me like I'm crazy. And I'm like, you can't grade the learner if you're not good at what you're doing and you're just brand new at this. So if you're not competent, I mean, I have on here if you're not expert, but if you're not competent, if you're a beginner or an advanced beginner in teaching online, then you have to really carefully think about whether it's fair to attach grades to your learner's performance. And here's my biggest question of all. Is it important that they demonstrate competency on a skill right now? Do they have to do it right now? Or can the curriculum be realigned to move some didactic material from next semester forward and then refocus on skills at the start of next semester or whenever the schools reopen? We don't even know when that's going to be yet. Can the SIM and the skills lab time be made up? I know there's a lot of talk about boot camps. I think there's plans in the making for a webinar about boot camps in the near future as well. So, and don't get me wrong, I'm an academic too. I know it's not easy to reshuffle the curriculum, but it's something to think about. And then again, consider all the ways that you currently evaluate simulation. I think you'll find most of them are still very applicable. You just might need to tweak them a little bit based on some of the things that I discussed. So what do I think we'll learn? I think it's going to be ugly. I do. Overall, in general, it's a very generalized statement, but I think our initial efforts are just not going to give us the results that we're used to seeing, because we had to do this fast and we had to do it without, in some cases, without support and without resources. So I think you have to be very, very kind to yourself. And I think that you should not expect perfection. And that's also a problem that many of us have, is that we expect to be experts and to be really good at what we're doing. And we have to give ourselves some grace and realize that not only are we not in a good situation rushing things online, but we also have the same emotional and cognitive challenges that our learners do. Those who do well and have good outcomes, please, you guys got to share this. Formally, informally, I don't care how, just share it. Don't wait for a conference. You can share it at the conference, but get it out there fast. do a brief webinar, create a video of yourself and put it on LinkedIn. Do whatever you can to let the rest of us know what is working. It goes back to that whole recreating the wheel idea. And then when you have time, you publish it, present it. Anybody that can get some research going in some of these areas, I think will be a really big help. And we're going to get better at this because it looks like we might have some more time to do this. So my words of wisdom for you at the end here is, I think that these are the four most important things about all of this, is that you have to have grace. You just have to understand that our students can't perform to the level that we expect them to, and neither can we. Everybody's doing the best they can with the knowledge that they have, with the resources that they have, with the emotional, whatever's left in the tank. Everybody's doing the best that they can. And so, just have mercy and empathize with people. Not everybody is a frontline worker, but we have great empathy for those who are. And then, the Ellen principle of be kind to one another. Just always assume good intent, that everybody is doing the best they can to meet your learning objectives. So that's all I have for tonight. So today. So I'll turn this back over to Kathy, and maybe she's been collecting some questions from you along the way.
Kim, what a fantastic presentation. Thank you so much. We do have a couple of comments, lots of thanks and acknowledgments also, but when evaluating students after virtual simulation scenarios, should this be specific to each sim or clinical overall? This individual school has smart evaluations that are sent to students after each clinical session. Are both best, or are they too much?
Okay, yeah, that's a great question. My belief is that the students should do an evaluation after every online simulation experience. And I have the same thoughts for when they're in the traditional sim lab as well. Sometimes it feels like it's too much, especially if they've got, several experiences in a semester, but it's how you're going to find out if what you've created for them is effective. So let's say you do 7 different scenarios online in a semester, and you only evaluate at the end of the semester, and they say, the simulation didn't meet my learning needs for X, Y, or Z. You're not going to know which scenario they're talking about. So how do you go back and fix it if you don't have that detailed information? The other thing that I recommend is that you do the ongoing evaluations until it's stable. And by stable, I mean until they start coming back looking the same 2 or 3 times in a row. But if you then have somebody new as a facilitator, you have to start again. If you have a new SimTech, if you have a new faculty person, because every one of those 3 people is going to perform differently than the person who came before them. And so I remember having this conversation when I worked in Lincoln, and I was actually the one who wanted to get rid of the evaluations there, mostly because that's where they were piling up on my desk. But the faculty wanted to keep them because it helped them stay on target and know what needed to be changed.
Thanks for the clarification, face-to-face versus virtual sims versus traditional sims. So other words that we can be using, face-to-face is a good one. So thanks for that comment. Faculty instructors in behavioral health in this individual's organization are using themselves as standardized patients with a 15 to 20 minute individual scenario with students. And so far, that's been very well received. So thanks for that one.
Great idea.
Lots of thank yous. We get feedback from every skills day and every simulation at the end of the day. They use Qualtrics QR codes, and the students use their smartphones or our workstation on wheels.
Excellent.
Lots of kudos and thank yous, Kim. Not too many more questions. We do have a couple minutes left, so if anyone has a question, go ahead. And you can also unmute if you would like to say hello and share a comment.
I'm going to add something, Kathy, that I meant to put it on a slide and I forgot. But we're doing a research study now. The Clinical Learning Environment Comparison Survey, the CLEX, was used in the National Council of State Boards of Nursing in that longitudinal study. That was the tool I developed for my dissertation. So I pulled it out a couple of weeks ago and got a research team together with Colette Foisy-Dahl up at MacEwan University in Canada, Susie Cardon-Egren, and Tanya Sneederreith. And we've got over 100 responses already, but we're using a social media snowball sampling strategy to try to reach the students who are at home for two reasons. One, because they're not at school, so we can't rely on our friendly faculty to help us out on that. And so we're trying to reach them through social media, but also we felt it was so time sensitive that we did not want to go down the route of a multi-site study because it involves so many IRB applications. So if anybody can help disseminate that information to their students, it can be found on our website, which is sim-eval.org. It's the second tab, has the information for the students. I've also put it out on Facebook and LinkedIn, and NLN retweeted it the other day, so that was exciting. But anything that people can do to help us get the word out to their students is greatly appreciated.
So Sarah Tidwell, what a fantastic idea. Why don't we just do a webinar on research ideas around COVID-19? She is nearing her dissertation to throw ideas around. I will task the research committee with that. I bet they would love to have that discussion.
That's a great idea.
Fantastic. And we are going to be opening up our research grant program here in another month for applications. So perfect timing. That's a great idea. I love it. Let's see.
There's so much to do, and a lot of it is not going to be hard to do. It's just
there's a lot to do. We've been using a debriefing script for virtual debriefing, and that has worked really well. They used the virtual sim literature on debriefing and developed a script, so great idea. We are going to have a debriefing webinar next week. I haven't released the topics yet next week. I'm just finalizing a couple titles, but we will have another debriefing next week too. So I know that's a hot topic as well. We've moved our unfolding Sims to the online format, and despite no equipment, it's gone really well. Thank you, Sharon. Sharon, can you unmute and tell us a little bit about how that came to be?
Hello.
Sharon, we can hear you.
Okay, so we actually integrated simulation into our program a few years ago, where the clinical groups have to come in for 1 day of simulation, and we've done an unfolding simulation for pediatrics where the child comes from home to the clinic, to the emergency room, to the pediatric floor, to discharge planning. So we've been doing that in the simulation lab, and of course when we had to go online quickly, we thought, well, let's just try it online. So all of the students logged in, and we assigned 2 nurses to each act. And, you know, obviously we had no equipment or mannequins, but, you know, hi, I'm Sharon. I'm going to be your nurse today. Can you tell me your name and date of birth? I'm washing my hands. Okay, I'm listening to the lungs. What do the lungs sound like? What are the labs? And we did that with our OB sim, and things went really, really well. We were really surprised how engaged they were. And, you know, obviously the debriefing is so important, and they really got a lot of the concepts that we were hoping they would get.
That's fantastic.
That's awesome. Sue commented that this was helpful. Their 2020 semester clinical sections will be online. Our clinical sites are not allowing students to return, or some only 3 in a group. And of course, Sue, this is what we're hearing all over the world, is that they're going to have to try to get clinical online, which is tricky. So there have been some centers that are doing, there are recordings on our COVID-19 webpage about bringing Clinical Sims Online. That was an OSCE presentation. And I do think, Kim, that the University of Minnesota did one on IPE Sims Online. I think.
I think so too, yeah.
So go check that out. There are lots of resources there, and all of those programs are free. Lots of examples of what people are trying to do. And we've got a place there to just post links and videos and things like that. So go ahead and share whatever you're doing, as well as Kim encouraged you. It's really important that we keep communicating through all of this. We've come to the end of our time. It is the top of the hour. Just a reminder that this program is accredited for joint continuing education. So we are interprofessional, and we're all about that. So you will be getting instructions about obtaining your CEUs through our Live Learning Center in a couple of weeks. We thank you again for joining us. Tomorrow, we don't have a program tomorrow, but we have two on Thursday. One from our operations at 1 p.m. Eastern, and then at 2 p.m. Eastern, our colleague Dawn Swiderski is going to be sharing some of the clinical simulation vignettes they've been doing online during COVID-19, some really effective scenarios. So you're going to want to make sure to tune in for that as well. Coming up next week, we'll be talking about debriefing. We've got some Insight to provider training that's been going on at Camels in Tampa, and that will be showcased as well. And we're hoping to get some more work on boot camps. So stay tuned for the details, but we'll be coming next week as well. So everyone stay safe. Thank you to Kim. Fantastic presentation, Kim. Thank you so much.
Thank you all for joining me. It's been fun.
It's awesome. And this will be recorded and available later this afternoon on our COVID-19 webpage. Thanks, everybody. We're thankful that you're with us, and stay safe. Bye-bye.
Bye.